All right, y'all. Hey, so I'm at the cardiologist right now, waiting to talk to my doctor. So basically, they said that I gained 3 pounds, but I think the scale that they have me on, is not really accurate. So I really don't, but we're not gonna say that. I'm just gonna say I gained 3 pounds, but I don't know how I gained 3 pounds because I've been working out every day. I've been eating a sound diet, sticking to my diet, minus that one day. So, but also I have to keep in mind that with heart failure, that your body can retain a lot of liquid. But I haven't even been drinking a lot of liquid, so we're gonna see what they say, y'all. We're gonna see what happens. We're gonna see. Hi.
How's it going? How you
It's
doing?
going. I'm still here.
Right, so who's your doctor that sent you to me?
Well, actually, I think that they made an appointment for you through the Life Vest.
Oh, okay.
To see if I can continue to get the Life Vest.
Oh, okay.
I do have another cardiologist.
Who's your cardiologist?
He's Dr. Mukesh through Adventist Health.
Okay. Mukesh?
Yeah, his name is Mukesh.
Where's he located?
He's in Glendale, off of Cesar Chavez.
Oh, okay.
Yeah, so he's kind of like, I don't know.
But he's a heart doctor.
Yeah, he's a cardiologist.
Okay. It says Dr.
Rafi?
Rafi, okay.
Yeah, he was the first when I first got diagnosed with
Right, okay.
He was the one I saw in the ER.
Which hospital was it at?
It was at Glendale Memorial.
Memorial, okay, gotcha. Okay. All right, so then how long have you had this
Since October. I've been diagnosed since October. Basically, I think that it's because I had a baby.
Right.
I had a baby, so I'm thinking postpartum cardiomyopathy.
Right. Okay.
Yes, it was only 4 months after I had my baby. I had my baby in June, boom. In October, cardio failure. So I'm thinking that's what it is. And I just went to the cardiologist on the 5th. And I went down to 357 from 361, and now I'm back up to 360. I'm sticking to my diet, doing workout. I think it's water retention. I don't know. It has to be because I'm not like eating over any. I'm barely eating, So I don't know what's going on with that. But I just want to know like some alternatives because I feel like my cardiologist that I'm going to, he's not really interested in helping me the way that I need to be helped. You know what I'm saying? So. Yeah, I just.
East Los Angeles. Oh, Cesar Chavez. So.
Yeah.
The PA. Did you see? Was it Dr.
Mukesh?
Mukesh. Oh, Suresh Rao. Did you ever meet Dr. Rao, or you never met him?
I don't know. I'm not sure if that's his. I'm not sure. I know it's only one person I've ever seen when I went to that office, and that was, I think his name is Mukesh.
Right, okay.
Yes.
And they repeated your ultrasound in February.
Yes, and it got worse. But that's because I believe I was smoking. I was smoking daily, a lot.
Cigarettes?
Yes, smoking cigarettes and marijuana. But since the 24th of last month, I have not smoked at all. And I've started my diet as well.
Any other drugs?
No.
Like,
no drugs at all. No alcohol.
Let me just make a few notes here. Do you check your blood pressure at home ever or not?
I wasn't instructed to, no.
Okay.
But I do have a blood pressure monitor. Is that something I should be checking daily?
Well, I mean, it gets to, you're on, so your prognosis, first of all, do you have any siblings or anybody else with heart problems in your family or not?
Well, my grandmother, she had heart She had to get a quadruple bypass. She had heart problems. Yes.
What about your parents? Or
no.
Okay. Do you have brothers, sisters? Are they healthy? Or?
Yeah, they're healthy. Mm-hmm.
Okay, and this was your first child? Or?
No, this is my second child.
Second child?
Mm-hmm.
You did okay with the first one? Okay.
Yep. And I had C-section with this child as well.
Are you working, or what's a typical day?
No, I'm not working. I'm just taking care of my kids on a day-to-day.
And how let's see, any other medical problems besides the heart, or not?
Nope, I've never had any medical issues other than being overweight.
Mm-hmm.
Like ever.
Mm-hmm. Okay. Did you ever have diabetes or not?
Never had any
surgeries or other surgeries?
No, never had any health problems. Mm-hmm. Well, other than I have hidradenitis suppurativa, but it's skin.
Gotcha.
Yeah, I don't really count that.
Increased, or are you on sort of the same dose the whole time?
I've been on the same dose since October. I've asked about getting it adjusted, and they said it's not necessary. So, yeah.
Daily, like, what do you do on a typical day?
Basically, in the morning when I wake up, I take my medicine about 7 o'clock, get my daughter ready for school. Then I get up and I walk around the block. I started at first, when I first did this, I started about 30 minutes, but then it started affecting my breathing and my machine started going off. Mm-hmm. So I took it down significantly to about 15 minutes. So now in the morning I walk about 15 minutes a day. It's slow. I do it slowly though, just as to not overexert myself. But after that, then I have a 9-month-old baby, so I'm up around the house with her all day. Cook dinner, regular housewife stuff.
Sure.
Yeah.
Okay.
You think that I should be doing more?
Yeah. Well, yeah. I mean, the more you do, the better. But
What?
All right, so so the reason you're referred to me, so your main heart doctor is Mukesh or whatever, is he's the PA, but he's working under the other heart doctor. Dr. Rao is that doctor. Okay.
Okay.
So anyway, they're kind of in charge of your global care. When you see them, I mean, there is data that you're better off if the medicines can be increased.
Okay.
But but your heart is probably in some people the postpartum, it's in many people it's permanent. Okay, there is a certain percentage of people it reverses, but yours did not. So so now the issue is about the cardiac defibrillator, and the hitch with the weakened heart muscle is there is a possibility you could have a cardiac arrest and die suddenly. Okay?
Yes.
That's what the life vest is there for.
Right. Yes.
That's due to ventricular fibrillation, lower chamber arrhythmia,
Mm-hmm.
cardiac arrest. Now the way that we protect against that is with a cardiac defibrillator. Okay.
Mm-hmm.
What that is an implanted device that goes under the skin.
Mm-hmm.
There's 2 wires that go inside the heart. Okay, and then this device will watch your heart, and if it ever goes to this arrhythmia, then the device can shock you back to life. Okay.
Right.
So the risk, the procedure takes about an hour. We do it under sedation. The risk of a major complication is less than 1%. Luckily, it's a very safe procedure. Minor complication is 2%. One of the wires moving, some excess bruising or swelling, all those things together is around 2% risk. And then we follow you after the procedure with, see you in the office, and we check it with the laptop computer and so forth, okay? But it does make sense to do the procedure for you. And that's why you refer to me. I'm a cardiac electrophysiologist, so I do these procedures, okay?
Okay, so let me ask you this. When you say that it didn't reverse, well, what is the time limit that you give it to reverse? I thought it was from 6 to 12 months.
Usually 90 days, 3 months, on the medicines. So it is not likely that for you to be low risk and not need the cardiac defibrillator, the ejection fraction will need to improve like into the 40s. Okay?
Right, of course.
I think your medications could be more aggressively given to you, and then that might improve your heart function. But the likelihood that it will get up to a point where you don't need a defibrillator is not likely, and that's my role in this is, do you need a defibrillator or not? I'm the guy that does it. You're on the Entresto is right, the Farxiga. You should be aware there's what we call the 4 pillars, the 4 medications for heart. Okay. One is the spironolactone. One's the Farxiga.
I don't take that.
You should be on that. Why are you not?
I don't know. I'm not a cardiologist. What's the Farxiga? What is it for?
That's
Entresto?
No, it's listed in one of your medicines here.
No, I never listed that. I'm taking.
Okay. Yeah, I'll just show you what we have, and then
I'm taking spironolactone, Entresto, metoprolol, atorvastatin, low dose aspirin, and Jardiance.
Okay. Oh, Jardiance. Okay, never mind. I'm sorry. Jardiance is equivalent. Okay, so you're on all the right medicines basically. Okay, so those are the 4 classes. Okay. So let's just review again there. So it's the Jardiance, the Entresto, the spironolactone. Those are dosed relatively at a fixed dose. The Toprol, you're on a low dose. So that we have people that you're on 25, we go up to 200 on that. Okay.
Sheesh.
And so, but you may not tolerate it. I don't know.
Well, what would make me not be able to tolerate it?
You would be fatigued, and blood pressure might run low. I don't know. So your option, to me, you meet the criteria for us to just go ahead and get you scheduled for the defibrillator. Okay.
But I would rather
if you would rather, try every last ditch effort to avoid it.
Yes.
Then you double up your Toprol today. And I'll see you back in 3 months, and if you feel fine, you double it up again. Okay, I'm serious. If you can get up to 100 a day, and you can split the doses. That's fine. Okay, and then we'll see you back in 3 months.
Yes.
Communicate that to the other doctors, and just say, I told Dr. McKenzie, I'm going to send them a note. I'm going to tell them I recommended proceeding with defibrillator. You're covered with the Life Vest. The Life Vest is essentially an external defibrillator. So
of course.
That's, if I do permanent defibrillator, it does not make you feel better, does not make your heart stronger. It just replaces the external.
Right.
Your risk is 30 to 40% over the course of 5 years that you're going to have a drop-dead cardiac arrest, which is high. But we don't know on any given day when that's going to happen.
Of course.
And then that's why you're stuck with the Life Vest, and you seem very compliant, which is great. So, but I think it's you could bump up that medicine, see what happens, and we'll go from there. All right.
Okay, definitely. And what about cardiac therapy? Would that be an option for me?
Well, what it is there is like cardiac fitness. That's fine. It would be the other guys writing it for you, but it's a program, and it's just graduated exercise. Sure, good idea.
Okay, definitely. Is there anything else you would recommend, like as far as to make everything, better, like as far as, because my other cardiologist told me that I should only be drinking 2 small water bottles a day.
Yeah, good idea. I agree with that.
Okay, and
watch your fluid.
Eating no meat.
That part is less clear because your cholesterol, your arteries are fine. Okay.
Well, isn't red meat like the number one worst thing for your heart?
No, not necessarily.
Well, that's what the other cardiologist told me.
Yeah. Well, you could eat,
I feel like that's like conflicting information.
No, because see, the most common heart problem is due to blocked arteries, which is like cholesterol and all that stuff. You don't have, your heart condition's not due to blocked arteries.
Well, how do we know that? Because we've never checked.
Your artery, well, you could talk to them about that, but they do like stress tests or angiograms, but it would be very unlikely. We have a cause and effect. But that's okay. Did they do an angiogram on you?
No, I've never gotten an angiogram.
Okay, they go in the wrist and all that. Talk to the other doctors about that.
Okay.
Okay, because they could look into that.
Okay.
It's not likely though. Okay.
Okay.
You know, most likely it's postpartum. Okay, hold on one second.
So do you think that a reason that it didn't reverse is because I was on such a low dose of medicine?
In fairness, you know, you're only on, it's just one of the medicines that you might benefit from a higher dose, okay? And I don't know, I mean, the way many patients, they do get side effects as we increase the metoprolol. So I don't know. It may have been like you went to the office there one day and your blood pressure was low, and they just figured you're not going to tolerate it, because that does happen. So you only know if you try.
Of course. And
so if you have a blood pressure cuff, then you gotta, you can double up on that, see how you feel, check your pressure. As long as it's 90, 95 or higher, then that's okay, as long as you feel good. If you start to feel dizzy, lightheaded, then probably that's as much as you can take.
Okay.
All right, so not everybody can take like 100 milligrams.
Right.
If you can get up to 100 milligrams, then it's worth waiting 3 months and rechecking the heart function. If you are, if you take it and you don't really feel good, and 25 is where you're at, then you might as well just call back and get this done. Okay.
Of course. So for the procedure, what would be like? Okay, so once I get procedure, like how would it happen? Where would I be getting cut at?
We make a little incision in the top chest area right here, about 4 centimeters. Device is the size of a cigarette lighter.
Okay.
And it goes under the skin.
Okay.
And the wires are flimsy. You can't really feel the wires. They go through your vein.
Okay. So after procedure, would it be like inpatient, outpatient?
You'll stay one night and home the next day.
Home the next day. Then what would be a recovery time?
You'll be fine the next day. Restrict your left arm movement for 6 weeks. You can do 90% of what you want, but you can't like be pulling stuff off a shelf with the left arm.
Okay. That's something I need to know, because I have a 9-month-old, so she's like,
use your right arm. Okay.
She sleeps on me at night.
Right.
So how would that work?
You gotta be careful with moving your arm too much. That's
okay.
All. Right.
Of course. And then also let me ask you, so if I were to get this, and I did get an arrhythmia, but I didn't my heart didn't stop, is it gonna shock me anyways? Because this thing goes off like when I don't know if it's arrhythmia, whatever it is. At one point in time, it went off like 4 times, and I had to stop it to not get shocked.
You had to stop it, right?
Yeah, I mean, it gives you 10 seconds warning, but it's like...
That's probably because it's like false detection. That's much less common with an implanted device. The fidelity, the accuracy is much more. So it's unlikely, basically, is the answer. If you get a shock, probably you were going to die.
Okay.
Okay.
Okay. That's good to know.
Nice to meet you.